Dr. Nguyen, I want to talk to you about periodontal disease, and this, I think, is a way overlooked and underrated subject. Here's what I constantly hear doctors, dentists saying when it comes to periodontal disease. I hear them saying, if you do not fix your periodontal disease, at whatever stage it is at that moment, since there are many stages, obviously, if you do not fix it, you will lose your teeth. Now, that could happen in 2 years, in 6 years, in 10 years, whatever. And while losing your teeth is, I think, of course, a bad thing, it costs a lots of money to put them back in and blah, blah, blah. Nevertheless, you dentists are very good in fixing missing teeth. You have implants, you have dental dentures, implant supported, not even very expensive, can make the smile gorgeous and enhance the lips and everything. Basically, you guys are so good that we don't have to worry about losing our teeth. But here's what I think is happening, and which some doctors heavily support, and that is, while you have this periodontal disease, while your teeth are slowly getting loose and falling out, you're poisoning your body. You have that yellow, ugly, reddish pus in your mouth, dripping down the blood, because the gums is the gateway to the blood vessels. Everything in the gums goes into the blood vessels like that. So it goes down to the heart, it goes heart attack, it goes up to the brain, Alzheimer, it goes to the kidney, it ruins the liver, it ruins the immune system. Apparently babies get born premature and underweight. Even in California, we had cases of stillborn babies because they found that yellow, ugly pus in the placenta of the mom. Coming from the gum disease. If it does something so severe, obviously the immune system for the everyday cold, everything would be affected by it. People would just have a really bad life. Is what I'm saying, am I out of proportion here, or is there any truth to it?
Oh, you are absolutely right about that. And it's actually, it's been proven by the American Heart Association too. And they were saying, they found a link between gum disease and systemic heart problems, all kind of things that could go wrong. So it's, it's very important. It's a serious problem.
I think there will be the day, which unfortunately is not here, where an MD will lose his license, as he should, if he doesn't send people to a dentist to fix their gum disease. Because they're not doing that. They know it, but they're kind of like not paying attention to it. And yet, I don't know, tell me whether you have noticed that, and there are the surgeons, the guys who take out Pendex, or the guys who do a knee operation or a hip operation, they demand a clean bill of oral health. And by that, they don't care about a couple cavities, they don't care about crooked teeth or whatever it is. They just care about gum disease. Because they say, if you have a gum disease, any surgery in the body could go wrong. The surgery could get infected in itself and never heal. Or the body is so weakened to this infection in the body that it cannot stand another cut, and thus they demand that. Have you noticed that trend lately a lot more?
You mean like they require for having like really clean?
They send the people, a surgeon, except in an emergency, if you come in with a bullet in your heart, that's different, they cut on you. But rather than that, they demand that you have no infection, just like they forever demanded, I don't do your appendix operation if you have a heavy lung infection. I don't do your knee operation if you have a heavy lung infection. Any infection in the body, they always knew not to operate. They just always overlooked the gum disease.
Yeah, that's kind of a sad thing, but yeah, I do notice that too. And always stressing to my patient, the main thing about gum disease is that it doesn't really hurt you. And once it hurts, it means that it's already too late. You've already been,
like cancer. Like a heart attack. I mean, they keep saying a sudden heart attack. Nothing sudden about it. It built up for 25, 35, 45 years.
It's got to be there. Yeah, it's just building up without you noticing it. Or even if you know about it, but you're like, oh, it doesn't hurt, we'll take care of it when it comes. And then when it comes, it's a little too late. Either you end up, having tons of infection, or you're going to end up having, like your teeth, all the teeth have to be removed, pulled out.
And during that time, you weakened your body. You weakened all those organs during that time. And it's much more difficult to repair your liver, your kidney, or your brain kind of like damage than to repair the teeth. That's, thanks God, with a little bit of money or lots of money, but that's easy to repair, at least clinically. You know, having Alzheimer, having a failed kidney and a failed liver, or a failed immune system, period, that's very difficult to repair.
That is all serious, so it's a big topic, and I've been trying to explain, and I've been doing all of that to my patients so far, and then stressing on the importance of getting in, get it checked out. You got gum disease, you need to get it treated because it leads to a serious problem. It's not just the gum. It's not just that.
Right.
It's your whole body.
It's difficult to understand because when people have a little infection on their skin, let's say big like a dime, a nickel or something like that, right? And it doesn't go away, they run to a dermatologist very fast. As they should.
That's true.
Yeah. But in mouth, I have heard that if it's a full-blown mouth infection, the infection is as big as a hand. Is that true?
Oh yeah, I've seen some really serious infection, and you pretty much have to be hospitalized, with all the IV antibiotics, like the whole 9 yards. And it's from one little tooth with a little, infection, but it is brewing along the way. And then it just blow up. Yeah. So yes, this could get very serious.
Right. Well, an infection by definition is something which infects other parts. It's a little bit like having one rotten apple in a basket of beautiful apples. At the beginning, no big deal. The apple by itself rats. The other one get a little bit funny, and bang, it goes like that. It infects other areas very fast. It grows like a mushroom, and which is so. Well, I hope that this video is helping your patients to people who see it to act on it, because frankly, I think many overall lifestyle issues such as diet, fatigue, getting the flu with the smallest little wind and all that stuff could be, if not eliminated, helped out drastically, and thus overall the energy. I mean, a person with no energy is suffering, and he doesn't even know it because he doesn't know anymore. It's like a dimmer switch. He doesn't know what it means to have energy. And I'm not saying the gum disease is the only thing which leads to that, but it's surely one big part of it, right?
It is. It will have some very serious consequences. And so, I do hope that this kind of, open the eyes of some people and shed some light on the seriousness of the issue and get it checked, get it taken care of, and don't delay on it.
Okay. Thank you very much, Dr. Nguyen, for this information. Thank you very much.
Thank you for having me.